Hello everybody, welcome back to The London Nurse. I am Ben, and as the title suggests, we are focusing again on first year students in clinical practice. This video is going to kind of run from the beginning of a shift to the end of a shift to make sure that there's some kind of order to what I'm saying. And the aim of the video is to kind of point out some of the secrets, some of the things that kind of go on in the day-to-day running of a nurse's shift. Now, no amount of preparation will prepare you for your first clinical placement or even your first clinical shift, because even for those of you that have been in hospitals to see relatives or friends, or you have family members that work in the hospital, nothing will prepare you for how you are going to experience the clinical environment for the first time. In my previous video, we were talking about everything to do with kind of preparing yourself for that first clinical shift. I have had some comments about during this current pandemic not kind of suggesting that people should be going into hospital, so I'd mentioned about arranging a visit to go in and see that clinical area. But obviously, while there is still restrictions on unnecessary travel, obviously hospitals still aren't letting people in that don't necessarily need to be on the clinical site. So hopefully this video will stay up for much longer than COVID is currently in the pandemic stage, but just to point that out. Now, the first thing that I would like to talk to you about is handover. Now, every ward does things very differently, but every ward usually has some kind of handover period. Even if it's a day case unit, you would still gather together as a clinical team to kind of look at the setup for the day. So either way, whether it's in handover, which is the majority of the wards run, or in your kind of briefing session as a clinical team prior to your shift, you are going to be bombarded with clinical jargon that, while we say that we will try to avoid, it's still a lot easier to use the medical terminology when referring to the clinical conditions and treatments and progress of our patients. So you will find yourself probably not understanding at least 50% of what is said in a handover or a briefing, but do not let that put you off, okay? Within the first couple of days, the first couple of shifts, you are going to start to get the lingo, and it is all going to become somewhat a little bit more familiar than your first ever moment in handover. I've got a couple of tips that might help you kind of get through handover a little bit easier, but also to use a handover period as a learning opportunity. So whether you still have paper to do your handovers or whether it's done electronically, in my previous video I said to get a notebook. Now, this notebook, you can either jot down the points at handover, or if you still have paper handovers, then a tip is to kind of have either highlighters or a multicoloured pen, like, I don't know what they're called, but you've kind of got a pen with like 6 different colours on it. Link in the description below. Get one of these pens so you can highlight the different parts of that handover sheet. Highlight any points that you don't know, highlight any points that you think might be important, and that way you'll be able to then, in your downtime in the shift, kind of start to look up some of those points. As the shifts go on, you'll probably find your own way to identify important points. So for me, for patients that were due to be discharged, I would draw just a tiny little kind of outline of a house on the handover next to their name, or I would write on there the important parts that need to be done. So get used to scribbling all over it, not to the point that you can't actually read the handover, but to the point that it becomes helpful as a tool for learning for you. So you're out of handover, and now is the point at which you are going to plan your day. Again, if you have a paper handout, then you can use this to kind of plan your day. As a student, you are very, very, very entitled to have a day planner. So these are templates that you can print off, but basically what it is it's your 12-hour shift marked out along the side, and then columns kind of representing the patients that you're looking after. Dependent on your workload will depend on how many columns you obviously write. If you've got 4 patients, then have 4 columns, and so on. The idea then is that you would write down hour by hour what the plan of that patient's care is going to be for the day. At this point, you'll be working under direction of the person that you're working with, so all that's expected of you as a first year student making a plan for the day is just to have an awareness that that kind of happens, that you need to plan out your day as a nurse. The person that you're working with will help you do that. Now, again, if there are students or healthcare assistants on that shift with you, and the students have kind of been there for longer, then link up with the student and get them them to kind of show you what the day usually looks like in that ward area. They could also give you some specific tips on how to plan out your day according to that clinical area. This is also a great opportunity to highlight any potential learning opportunities for the day. Now, in handover, at this point on your first day, you probably will have not realised the amount of stuff that is going on the ward that will be interesting to you, but as you kind of go through the placement in that handover period, they will start to talk about things that are going on in the day, and you can then make notes of, that sounds interesting, I might go and work with that nurse at 2 o'clock, have a look at that procedure being done, and then at 6 o'clock this patient is going there and I'd like to go and see if I can do that too with that patient. You would then go to your assessor or supervisor for that day and try to plan that in. You are a student, you are what is called supernumerary, which basically means that you're not counted in the numbers, which enables you to kind of use those learning opportunities wisely, so that if you have a calmer period on the ward, then you can use these times to go off and learn other things that have sparked your interest. Another tip at this point, in nursing, we don't use the word quiet. If you say the word quiet on the ward, all hell will break loose. Once you've made the plan for your day, this is the time that you either can shadow the nurse you're working with completing all of the paperwork at this point, or you go and meet the patients themselves. Remember that first impressions are key, okay? So you at this point will be meeting the families that you'll be working with all day for the first time. So you are going to want to make sure that this is the point that you make a good impression. You could start conversations around what the patient wants to get out of their day to day. Now be prepared, they will ask you questions like, when's the ward round? When's doctor come in? Have my blood results come back yet? When do I start that new antibiotic? You've got to introduce yourself as the student nurse. You have to say it. Hi, I'm Ben. I'm the student nurse on today. It's my first ever day. But don't worry, anything that I don't know, I'll go back to the nurse that I'm working with to make sure that that help is given if you need it there and then. Start to get used to introducing yourself as a student nurse. It's actually quite a comfy spot, so I think I might just stay here for the rest of the video. Soz. Key things for you as a first year student to start to embed into your daily practice as a nurse is to take your breaks. Now, every ward has its own different ways of kind of breaking the day up for their staff, but often you kind of get an hour for your lunch. That hour is unpaid, so it could be broken up into kind of half an hour slot, and then maybe some 2 15-minute breaks in the morning and the evening, but find out kind of what the break plan is for the day. Not straight away, because if the first question out of your mouth is, so what are the breaks like today? It's going to make you look like you're not keen to learn. Take your breaks. Do not be one of those people that goes, oh no, I'm fine, I don't need a break, I'm fine, carrying on. Working 12-hour shifts is knackering, and it's not necessarily what the body is intended to do. So you've got to make sure that you are taking adequate breaks, drinking plenty of water, and eating as well. So get the plan of the breaks for the day, make sure that you plan them into your daily planner as well. Again, I said it in my other video, but take every opportunity that is given to you to learn. Not only will this help you start understanding what kind of happens on the ward so you can start to plan your learning objectives, but it'll also speed up the day. It really shows the person you're working with that you are taking initiative and you're being responsible for your own learning. There are so many people on shift that will be able to support you, not just the person that you're working with. The key people to kind of understanding how a ward works are not only the staff nurses, but the healthcare assistants, other students, maybe apprentices if they're working on the ward as well, the housekeeper or whatever they're called in your areas. Those are the people that are usually responsible for making sure that the clinical area is safely stocked up and looked after, taken care of, and possibly even the cleaners as well. Using all of these people, introducing yourself to them, starting to build up some kind of relationship and network with them will help you then in the future on that placement. They have so much experience and such a wealth of understanding of how the nurses work on the ward area, what's expected of students in that area, and also just understanding the kind of working ethos in that area as well. Now, towards the kind of end of the shift, one of the key things that happens is nurses start to write their handovers. Now, this could be done throughout the day, depending on kind of the clinical systems that you've got in place, but a majority of the time they are written towards the end of the day so you can actually write an adequate evaluation of the care that you've given and updating the patient's current clinical condition. Start to learn about that process from the get-go, and the earlier that you start to learn that process, the better. If you are a student and you are watching this, leave a comment below, and if you haven't already, definitely hit that subscribe button. It's really helping me out, and if you like this video, give it a thumbs up, and until the next time, take care.